We've talked about obesity as an epidemic facing the world. What about diseases that more specifically affect our guts? Things like colon cancer or Crohn's disease, for example. How do our microbes play into those? The answer is microbial dysbiosis, which links microbial diversity to disease. As we discussed earlier, most of the microbes in your gut are there to do good. They're either beneficial or at least harmless. And this makes sense in a way because they outnumber us so vastly that if they were out to get us, we'd really be in trouble. So these beneficial microbes maintain a balance in healthy people, a stable state known as homeostasis. Now, when you get sick or when you have a chronic disease, the composition of the microbial community in your gut may change, and you may have more harmful microbes, in other words, the pathogens, than you do beneficial ones. So this phenomenon, where the gut microbial community is out of balance, is known as dysbiosis. That is, the balance has shifted, and the stable state of health and homeostasis is no longer maintained in the gut. This is associated with responses from the immune system, such as inflammation. Some acute gastrointestinal illnesses, for example, E. coli infection, cholera, and Clostridium difficile infection, can cause such dramatic changes that gut microbial communities look more like communities normally found at some totally different part of the body, like, for example, the skin, rather than looking like the normal community in the gut. Dysbiosis has been observed in people with more chronic diseases, like inflammatory bowel disease, Crohn's disease, and colorectal cancer. Another thing that happens when you get a disease is that diversity in the gut microbial communities often tends to decrease. Healthy people usually have many more different types of microbes in their guts than those with chronic diseases. And so this is an answer to that question: why should you care about the diversity in your gut? Does it really matter how many kinds of microbes are in there? Or is it pretty much irrelevant to your life? So let's take a look at a few specific examples.